Good evening, everyone. I'm Dawn Broderick. I'm the Executive Director of Workforce for King's. I've been at King's for about 2 years, 3 months, and have accountability for the full range of workforce issues across the Trust. 11,500 people actually work at King's at the moment across 5 main sites. So that's kind of a background.
Okay. I'm Peter Amstel. I'm the Associate Director of Workforce Operations, and within my remit that includes the recruitment to the Trust.
Okay, and just for members' sake, there's a report in your supplementary agenda from page 11 onwards. Okay, so do you want to say a few words? You're obviously familiar with the report that's been submitted.
I thought we'd just pick out some highlights or lowlights, whatever. So I think to start, the first slide is the national and local position. I mean, you'll all be familiar from the news about the national position with kind of nurse recruitment and across the UK, and there's some of the figures there. I think the one to pick out is in London. This year's 12,700 nursing vacancies across London, compared to 2015 when there were 10,100 vacancies. So you can see it is a deteriorating picture across our nursing profession, and of course, depending on what you think, nursing is the lifeblood of the NHS and is there doing the caring day in, day out. So it's a worry across the whole NHS, I think, about our kind of nursing workforce. I think, and if I move on, and I can take any questions on the national picture, but if I move to some of the headlines around King's, our trust vacancy rate is currently 11.18%, and that's across all our main professions. That's actually the best since 2015, so it's good timing. I'm here today because it is a moving feast, recruitment and retention across the NHS. And it is something that the team constantly have to work on month on month. And Peter will tell you a bit about that in a minute. I think one of our key successes is our Band 5 nursing vacancy rate, which has now dropped to 9.14%, which we're very pleased about. And further down on that list, network care is our specialist area, and that's around about 3,200 staff, and our vacancy rate for the first time has gone under 8%. So that's a 7% vacancy rate. And for urgent and planned, which is our biggest division, that's about 4,500 staff. It's now 8.49%. We have the highest permanent staff fill rate that we've ever had, actually, with 11,155 staff as at this month. Temporary staffing has reduced. We've had big improvement programmes from 14-15 onwards to reduce our agency spend. We have a cap set by NHS Improvement of 32 million, and with a fair wind and the next 5 months going as we forecast, will come in just under that cap. On retention, people often put recruitment and retention together, but the actions you take for each of them are very different in nature. We've made big progress on our voluntary turnover across King's, going from 17 just down to 14%, and we have a plan to do more, and I'll come back in a little bit and talk a bit more about that. Sickness is also on a downward trajectory, and our friends and family test, which is our staff filling a would you recommend King's as a place to work, is up 17% on last year. So that's the kind of headline metrics, and Peter will just give you a whistle-stop tour through some of the recruitment activity just for the next couple of minutes.
Thank you, Dawn. So we have to have around 3,000 new starters into the Trust, and that's broken down into a recruitment target of around 2,500. We have junior doctors on rotation programmes. We don't particularly classify those as recruitment, as we don't go out to market those particular individuals, but we still have an ambitious target of 2,500. I've just tried in the paper really just to give you some idea of the types of volumes that we deal with, placed on NHS jobs just between April and October this year. NHS Jobs is the sort of national e-recruitment portal, with over 1,700 adverts. What we have found is that we've been seeing this productivity really now coming in of increasing the number of non-medical starters in particularly, and between January and October 2016-17, that comparison, we've seen an increase from 1,667 to 1,732. We've got a number of initiatives that we have underway. These are sort of national initiatives, initiatives that do capture Europe and go overseas internationally as well. On the international side, we've got quite an ambitious target to recruit 400 nurses. Now, we started this particular initiative in July 2016, and these were really for deployments during 17-18, and we are currently on target to achieve that number by March of 2018. We envisage a similar sort of number in 2018-19. So the activity that we've got is a mixture really of centralised campaigns, and then we give a lot of support within the workforce at Directorate to our colleagues within our sort of divisional areas, doing things such as making sort of films to help with some of the recruitment campaigns, and also focusing very much on the nursing activity of healthcare assistants, band 5s and band 6, which is our largest part of the workforce. I just read on pages 5 and 6, just trying to give a little bit of a snapshot of some of the key headlines of what we've been doing in the various some months, and these are mixtures of sort of careers fairs, the sort of open days that we have, some visits to universities, really trying to get as many newly qualified nurses interested in King's as we can. Open days at our own sites, and then the international recruitment as well. We've had just a recent recruitment campaign in Australia, which was a new initiative for us, and that has proved to be very successful. And we've made 58 offers for nurses just on that one campaign. And then so we will continue with both the university engagement for newly qualified nurses, partnerships that we've got in place for other sort of agencies to help us with national and international recruitment.
Okay, and just finally, just for the last minute, on retention, I mean, I think it goes without saying that some of the big issues around retention are around pay, kind of housing and travel. But put those to one side for a minute and talk about what we're doing across the trust to really improve the employee experience. And from our last year's staff survey, we asked all our staff the areas that they'd like to see more activity on, and they're the 6 work streams that we've been working on for the last 12 months. We've set ourselves some measures across the trust about how much we'd like to try and improve those, and the staff survey for this year is currently open at the moment. So by the new year we'll have our next set of results, and we can see how successful the work that we've done has been. It does take a while to embed change, because these are big work streams and big pieces of work across King's. I think we've also got a nursing retention plan that is in place, and we've had the retention group for nursing that's been running for the last 12 months. And some of that is focusing on the leadership of the nursing function and how we make sure we give people the most support, career development, learning and education that we can in their roles. We also review our exit questionnaires on a fairly regular basis to see if it's telling us anything that's different, anything we can act on. And all our plans on retention, we're working closely with NHS Improvement to have a look at what targets we're going to set ourselves for next year on our next level of improvement on retention. So, looking ahead, I'll do 30 seconds on this. Increase our kind of social media profile, which we've made huge progress on in the last 12 months. Continue with our focused recruitment, not only here but also international. Continue with our engagement activities around retention. We've got a new recruitment system going in January, which hopefully will speed up the recruitment process, and having a look at our time to hire and how we get our check-in process as slick as we possibly can, because in a very volatile, competitive market, if you take too long, you blink and someone's gone somewhere else. So this is about how we get as slick as we can in the core processes that we've got.
Okay, thank you very much. Councillor Paul?
Thank you, Chair. Very obvious question in relation to recruitment and the international elements of it. Brexit. So I'm quite interested to know what proportion of your recruitment focus is international, and to what extent that has been EU focused in the past, and whether that's changed since the Brexit process began.
Yeah.
I think even over the last 4 to 5 years, I would say our recruitment in mainland Europe only brings actually smaller numbers in. So we've had initiatives in Spain, in Portugal, in Romania. And still get quite a number of nurses come from Ireland, but these tend to be in smaller numbers compared with when we go on international recruitment initiatives, for example, the Philippines or India, where in the case of the Philippines, we're probably targeting somewhere in the region of 350 to 400 nurses.
Can I have one?
I was hoping for a damning line on Brexit.
Well,
we need a follow-up.
Give us some hints.
We want some headlines here. Yes, please.
It's not really a follow-up, it's a different question, so forgive me if I'm being a bit greedy. So I'm quite interested to know what the exit questionnaires say and the extent to which cost of living, particularly housing, factors in on that. And I did have sort of a question that was linked to the first set of presentations around housing, and particularly the extent to which you can influence the intermediate waiting lists that are being developed in different boroughs. Certainly Southwark has a consultation out now where we're looking at living, rent and shared ownership homes, and there being a common register, and basically a consultation looking at what type of priority public sector workers should be prioritised and given sort of the highest levels of eligibility for that list. So I wondered to what extent housing was a cost of living.
Well, I think people don't so much leave because of housing costs; they just don't join.
Right.
I think that's more the issue. That the exit questionnaires in general show it's more about seeking promotion, career development, flexible working, rather than saying I can't rent anywhere. Because I think there's less people joining the nursing profession, and what tends to happen is they make a life choice and they badge that as wanting a different kind of life and flexible working, but what that really means is they can afford to buy a house if they go to Newcastle or somewhere else. So we haven't particularly seen, have we, that housing has been up there in terms of a specific feedback bit, but it definitely is the reason why people choose to work in London or not. And what's interesting is of our total workforce, how many of our staff live in Lambeth and Southwark, for example, and it's not as many as you'd think. I think it was the last time we ran the data. It was about 1,000 of our workforce live in Southwark and 1,000 live in Lambeth. Now you would expect that, being a major employer, for that to be a lot higher, but I think there's housing, so it's about not joining is the housing issue.
I think we've got another question.
I do, but I don't want to be greedy. I'll come back to it because it is linked to something connected but elsewhere.
So Councillor Lamb.
Yeah, thank you, Chair. I first of all, I want to congratulate you on your achievement in relation to recruitment, temporary staff and retention on page, I think on page 13. Clearly you've made some very positive efforts to reduce, it's quite significant, so year in, year out, so that's, for me, it's it's good to notice that. So well done.
Thank you.
I just want to ask you. I mean, my colleague has a question in relation to the effect of Brexit, how it has affected retention, recruitment and retention. Did I hear you saying that it's very insignificant in terms of the effect? Is that?
I wouldn't say it was insignificant. I think it has a different impact on different bits of the workforce. So I think it has a bigger impact on medical. So we tend to attract people for, to come and do a research piece or something in the UK, and many of those were from Portugal or Spain. So I do think it has impacted, and we just did a piece on. So if you want some stuff on Brexit, if you look at the New York Times, we're in the New York Times this week, and it's all about Brexit and the impact on our medical workforce. So if you look it up online, you'll see it in there.
Okay. Thanks for that. Okay, my next question is, could you please tell me what the ratio of agency staff to permanent staff?
Well, broadly speaking, in a month, we use about 200 and something agency staff. That's how it translates out of our total workforce. We use a lot more bank staff, but a lot of bank staff are our own staff that are just doing an extra shift or an extra day a week to top up their pay. So it's a fairly small percentage of our total workforce, and of course my aim is to reduce that. You need the flexibility of that because of patient safety and quality issues, but ideally we would not use agent. We're trying to reduce our agency.
So we say year in year out, we say it's going up or down?
Down. It's going down.
Okay.
Yeah.
Because I noticed from the previous.
Yeah, it's gone down. I mean, it's gone down quite considerably in the last 3 years. I mean, if you can imagine, with every agency worker you use, there's a 20% agency premium on top of that. So just by replacing an agency worker with a permanent member of staff, you save 20% of that salary cost overnight, and that's how we've taken out the cost that you'll see in the presentation. But it's a constant focus, month on month, constant look at, because the market is very competitive at the moment.
Thank you. My final question is thank you. Last one. In relation to
colleagues are queuing. We've got waiting times.
How well do you think we are doing in terms of training of medical staff? Are we doing very well, or we still need some catching up to do?
Well, we have about 600 junior doctors in training. We have about 500, I think it is, post-grad every year. I have a lead consultant at TJ that leads the medical education team, and I run that as part of my outfit. We have areas that are amazing, and we have areas that we're working on, as you would expect, I think, in any large trust. But I think we rate the experience of our doctors they're assessed on a regular basis about areas for improvement, and I meet with the clinical teams about looking at what's gone well and what needs to be improved on a regular basis. So I think it's pretty good.
Thank you.
Okay.
Thank you.
Councillor Williams and then Councillor Dennis.
Well, thank you. I'll give you your dummy one-liner if you want. It's a nonsense, and I think the sectors that are going to be worse off for it are going to be the health and public sectors.
Yeah.
And it's the biggest suicide note in history. Anyway.
And is there a question?
Yeah, there is.
I agree with everything you say.
I'm just saying, as always,
Yeah.
You know the 6 streams?
Yeah.
Are you, and if so, what work is being done with other partners around that, especially kind of cross-peer mentoring and developing those streams to aid retention? And I'm thinking of Guys and Tommies, what work you're doing with those to flesh those out.
I mean, things like improving support for line managers and career and talent development. I mean, I think our main area of focus for career development is nursing, and we've developed a new talent tool that I'm talking to Lewisham about tomorrow in terms of how we get a different kind of career environment. So I think some of the opportunity is that we don't just recruit each other's staff the whole time.
Yeah.
Because that puts huge recruitment cost into the system, and it also artificially increases pay cost.
Yeah.
I think what we need to recognise though is that you've got to start in the areas that aren't the most competitive, because otherwise you just spend all your time trying to seek agreement, and then you find you can't. So things like we've got something called a transfer window that we've shared with Guys and Lewisham, which is if a nurse gets to the point where they'd like to move, rather than them move somewhere else and not tell us, they put their name in the transfer window, and then we give them a date 6 months hence where they're moving into a different discipline across King's. So it's that kind of thing. Okay. And I think the aim is that we do more career rotation and design more career offers across the STP rather than it just being one trust.
Sure.
So you spend a year in Guys, a year in King's, and a year in... But I think what we need to recognise is that you can't have winners and losers in that process. You know, it has to mean that Lewisham can still fill their vacancies, you know, that kind of thing. Yeah. So it's really getting that right for everyone, which isn't an immediate thing. You know, it takes a bit of working through as to what the impact might be if you have a shared bank, for example, for medical workforce. And that's where we are at the moment. So lots of work happening across the STP. Some of these things, though, around leadership visibility are kind of King's things, because we had a new senior team just got in place in the last 12 months.
Excellent, thank you.
Okay, that's Ernst.
Thank you. I've got 2 questions.
I was going to bring myself.
One was just going back to international recruitment. I was just interested in what the package is that's offered, to be honest, because I think the challenge is, you know, we're talking about jobs that are hard to fill domestically, because of often pressures on housing, affordability, cost of living, etc. So if you're somebody who's come over from the Philippines, what is it that you are offered to settle, to find affordable housing? And do you find that people from the international recruitment stay, or do they give feedback that actually it wasn't as they had expected, that they were missold a kind of offer? So I've got one other question after that, but maybe...
So I'll hand over to Peter in a minute, but just to say, I think our international recruits are less likely to leave.
Yes, I would agree with that. Certainly our statistics, show that. So what we do is we put a lot around the recruits based really on what we understand about their lives. So, in the Philippines, of course, cost of living, earnings, etc., are completely different than they are, in the Western world, and certainly, in the London, sort of area. So we give assistance both in terms of their flights and their accommodation, about making sure that they've got enough money to get them through, to the first payday. But a lot of other supports really as well, and that's about supporting settling them into the UK. I think we've been quite fortunate in one sense, is that because we've been recruiting internationally for quite some time. I've been at King's 16 years, and in fact I led on the first international recruitment trip to the Philippines. We built up, of course, a community that are now very well established at King's, even from those 16 sort of years ago, and they've helped us get an understanding of what Filipinos would expect when they're coming into the UK.
So the feedback is broadly, you're not worried by negative feedback from the international recruiters?
No, not really. I mean, I think it's the human touch, isn't it? From meeting them at Heathrow with a banner, welcome to King's. Taking them right through to the,
I think what you do get, of course, though, is that you can't treat every country exactly the same. So where we've been just recently to Australia, it's likely that those individuals may stay for a shorter period of time, perhaps typically 3 to 5 years, somewhere in that range, rather than Philippine nurses who might well stay a lot longer.
Thank you. And just one question on a slightly different topic. I mean, I've got particular interest in mental health, and there's been a lot of discussion in the news again about training more mental health nurses, etc. I just wondered we've got the general kind of picture here. In terms of particular specialisms, and particularly around mental health, does it kind of essentially mirror the kind of overall recruitment and retention picture, or are there other issues or gaps or related to other kind of specialisms in nursing?
Well, our mental health, I mean, we are opposite SLAM, which is our kind of mental health partner. So our recruitment for mental health nurses is very small compared to, so we're not really in the mental health recruitment market in the same way as we're in the other recruitment market, because we would work with our partners opposite about the support that they can provide. I think it's safe to say that in our emergency department, those patients with mental health issues are increasing. But I think that would be alongside the society, and where society is at the moment, and we're no different than any other trust nationally. So not a particular. I mean, I think probably some of the mental health trusts that we work the closest with, I think mental health nurse recruitment has always been a challenge, and I think continues to be. But then, to be honest, so is nursing recruitment outside mental health. So.
Okay, I've got 2 quick questions. I need to hand over back to Councillor Lewis. I'm sure there's in big trouble if we don't. But no, I will come back to you, Councillor Bullock. So my 2 quick questions are: should we feel guilty about the fact that we're recruiting nurses from the Philippines, and do we?
Yeah.
And secondly, is there an ambition or a target in regards to recruiting more staff from Southwark and Lambeth and surrounding boroughs? I mean, is that an ambition that you have as a trust to have more local staff?
Yeah, I mean, I think the way I would describe our ambition is that the makeup of Kings reflects the communities that we serve. Rather than saying you've got to live here, it's about the makeup, the diverse makeup of the organisation, and we've got a big piece of work on diversity and inclusion at the moment, and how do we attract from local communities. So if you're from a certain background and you come into Kings, it feels comfortable for you as an individual. And we've just been looking at our stats. 45% of the King's workforce as a whole is from a black or minority ethnic background. Of course, the community around Lambeth and Southwark would be higher than that, but then you've got to take into account our Bromley community as well, which is a very different demographic. So I think there are things we're doing to try and attract. Some of that is through the films that we're making to show more about what it would be like to work at King's. But I go to the corporate inductions every month on rotation with my other exec director colleagues, and invariably, I always ask people where they live. I always ask people, why they chose King's, and invariably that group is at least 50% from a BME background. So I think we're making strides. I think that the things
but no specific targets as such.
No, I don't think so, because it's quite difficult having a target about how you attract people from up the road. It needs to be linked to an apprenticeship program. So we've got apprenticeship programs that look. We go to the local job centres, for example, to source apprentices for King's. But of course, some of our recruitment is international, so it's quite difficult to target just in the local area.
And do we monitor sexuality?
Yeah, we monitor all protected groups. Yeah.
Okay. And just sorry, I don't know if you'd want to say any more on the international recruitment. I mean,
very happy to take.
Should we be taking foreign staff?
I've been asked this question before, and no, we don't feel guilty. We work very closely with the Philippines Overseas Employment Agency. The position really in the Philippines is that economic migration is one of their chief forms of income. rather sort of look at it, this way, that I would not want to deny people from other parts of the world earning good money for both for themselves and in fact for their families as well. And we see that on the faces of the individuals as well, who sort of thank us both for themselves, but obviously what they can look after their families, so as well. But there is very, we are very, very aware to make sure that we are doing everything, ethically, and that's why we work very closely with the, Overseas Employment Agency. And in fact, we are sort of arranging for the Philippines ambassador. I'll tell you about that. But,
breaking news. We've got our press release.
It's kind of different.
Absolutely. So Councillor Pollock's got like 2 minutes.
That's fine.
To deliver your question and get the answer.
I didn't realise. Going back to the housing issue and the kind of growth of intermediate housing and the type of tenures that are emerging that are specifically tailored for key workers to try and make that recruitment challenge a lot easier. It strikes me that specifically for Kings, there is a trade-off between the financial challenge that was talked about earlier and the recruitment challenge. I noticed on the new Southwark plan site allocations, the list of developable sites, that there's one mega site on the Denmark Hill campus east with I think more than 60,000 square metres of potential housing could be fit on there. And I just wondered whether there was a strong sort of corporate emphasis on that being for students and for medical students and for staff, and whether there was any sort of internal debate about the extent to which that asset can be sweated to try and relieve some of the other challenges that King's College has at the minute.
I mean, I think it's a good question about how do we relieve, because if you can improve the housing offer, then you improve the attract and also the retain bit of the workforce issue. I think this is always badged against the level of investment required and where does the investment come from to build in the first place. So we have this is probably what you're referring to, our estate's master plan that takes us through the next 20 years about how we change the makeup of the Denmark Hill site, particularly to be much more varied in what it offers. But I think that they're all long-term. I mean, the issue is you shouldn't stop doing long-term, but a lot of our nursing retention issues are here and now. So it's how do you get something now, versus 15 years or 10 years.
But better
time.
To get on with
yeah.
it. And
yeah, that's right. Yeah.
I'm conscious too that
so anything you can do to help us with our kind of key worker offer would be.
I wonder if bringing forward that site earlier rather than later is
I'm not sure I can answer that here, but
right.
It's hundreds of homes.
I'm afraid you're timed out, Councillor Pollock. So I'm going to hand over. Thank you very much for coming. It's very useful and informative. Obviously, anyone if you've made your presentations and you wish to go, you're very welcome to. Obviously, you can stay as well. And I'm going to hand over back to Councillor Lurie. But I now think.
It's up to you whether you're.
So anyway, so I'm now.
No,
I've been advised that maybe. So the next item is the Better Care Fund. And that came to Health and Wellbeing Board. And would you consider that to be a decision in the sense that we signed it off? Is that? You think it is? Yeah. Okay. Okay.
So David is going to step down.
Indeed, I'm going to sit down now for this item. So.